Now, from the News Channel 5 network, this is Medical Mondays.
Good evening, everyone. Welcome to Medical Monday. I'm Carrie Sharp. So glad you're joining us tonight. We have another great topic for you, especially if you have anything going wrong from your fingertip to your shoulder. I got the guy for you tonight. And of course, we are welcoming your phone calls. We'll get that number up in just a second. Dr. Jason Haslam is joining us, an orthopedic surgeon. Thank you so much for being in here.
Thank you.
You see patients all over Middle Tennessee because you have several different offices. Where are you set up?
Well, I have my main office is in Nashville. It's very close to Centennial Medical Center. And then I also have an office in Clarksville and an office in Dixon where I see patients.
And it's called the Haslam Hand Care Center?
That is correct, the Hand Care Center. We've changed the name to Ally Orthopedics because we now do all kinds of orthopedic surgery from fingertips to the tips of the toes. So it's Ally Orthopedics in Nashville, Performance Orthopedics in Clarksville, and in Dixon, it's Dixon Orthopedics and Sports Medicine.
But don't get confused by all those names because we're going to give you a phone number throughout the show that if you're interested in seeing Dr. Haslam, you can call, set up an appointment that way. So just have that notebook handy and a pen or paper handy or pen or pencil handy, and we'll get you that number. You do cover a lot of ground when it comes to the body and surgeries and things going wrong. What are the most common things you see?
Well, my fellowship training is upper extremity surgery, so I see a lot of hand, wrist, elbow, and shoulder injuries. And so I would say the majority of my practice is related to those areas of the body. Yeah.
And there's a lot to go wrong here, you know. I mean, and I was reading some of the material. Some of it can be genetic. Some of it can be from overuse or a traumatic injury. Anything stick out to you that you see a lot of complaints about?
Well, I would say probably the number one complaint I see in my office is related to a common diagnosis called carpal tunnel syndrome. And it is ubiquitous, and I have a lot of patients that have a lot of trouble with it, and so I see patients quite frequently for that particular problem.
I've heard lots of people just in the work setting complain about it, or they say, you know, I spend all day typing. What is carpal tunnel? What causes it, and then what do you do about it?
Well, carpal tunnel syndrome is a nerve-related problem, and what happens is there's a structure in the wrist area called the carpal tunnel, and there's a big nerve, and that nerve is called the median nerve. It's being entrapped in that tunnel. And when that nerve sees just a little bit too much pressure, it starts to give you lots of symptoms of numbness and tingling and pain. It can give all the sensations of a normal nerve when it's irritated. It can be burning or aching sensation, and it can be quite debilitating for patients, very painful. And so it's just related to a nerve compression problem in the wrist area.
So what do you do?
Well, there's several things you can do. We try not to do surgery right away. We try to get these things better without doing something operative. But frequently what we'll end up doing is a non-surgical intervention, conservative treatment. Typically we'll start off with things like wearing a wrist brace, for example. That positions the wrist in a good position for the carpal tunnel. If that's not working, then we'll sometimes inject a little bit of cortisone around that nerve in that tunnel, and sometimes that will decrease the inflammation. Sometimes if that's not working, we'll even do modalities such as physical therapy. Anti-inflammatories can sometimes be helpful for it. And when all else fails, then we sometimes resort to a surgical intervention for it.
And the rehab along with that is a couple of weeks, right?
Yeah, absolutely. Now the procedures have gotten a little less invasive. And so if you do a minimally invasive procedure, for example, what's called an endoscopic carpal tunnel release, I'm pretty liberal with what my patients do afterwards. I usually tell them if it hurts, stop doing it, but otherwise it's okay to start moving it. So I try to encourage movement of the fingers so things don't get too stiff afterwards. So I'm pretty aggressive about trying to get patients moving their hands relatively early.
I'm sure we'll get more calls about this. And by the way, we do have some calls. I want to encourage you to call in if you have a question for Dr. Haslam. The number is on the screen, 615-737+. As always, we will get to just as many calls as we can. So let's get started. We have Noel on the line. Good evening. Thanks for being part of the show. Go ahead with your question.
Hey, good afternoon, Dr. Haslam. I am experiencing some numbness and tingling in my thumb and forefinger and middle finger of my left hand, and I am severely left-handed. Is that carpal tunnel? Is that something that can be used? I'm on the computer all day, every day, so.
Yeah, that's a very common complaint associated with carpal tunnel syndrome. If I looked in the textbook at you, carpal tunnel syndrome, your picture would probably show up. It turns out that distribution that you're describing, the thumb, index, and long finger, is the distribution of the median nerve. and that is the nerve that's traveling in the carpal tunnel. So when patients come to me and say, this is where I'm having numbness and tingling, that's classic for carpal tunnel syndrome.
Okay.
So that's probably what you have. And do you have symptoms at nighttime? Do you feel it at nighttime also?
Yeah, a lot of aching and pain at night
Yeah, that's
for a long day.
Yeah, those are kind of classic symptoms of carpal tunnel syndrome. It can be very painful, and it also can affect the way your hand functions. Many patients will even drop things because the hand will become weaker because of the injury to the nerve. So yeah.
What should she do? Yeah, what can she do?
Well, one of the common treatments, as we mentioned before, is to try a wrist brace, and that wrist brace again is designed to put that tunnel in a good position to allow the nerve to have just a little bit more room. And so frequently what we'll do is we'll start you off by getting you a wrist brace. It's called a cock-up wrist brace.
It's not something you're going to go down to your drugstore and get and just say,
You actually can.
Really?
Yeah. Those drugstore braces are in a very similar shape as what we have in our office, and so it's okay to start off with something like that. And then, of course, when that's not working, then we start talking about using perhaps like a cortisone injection in the area of the carpal tunnel. And again, sometimes that works, and sometimes it just doesn't work, and patients will come back with what we call breakthrough pain, and then we start talking about doing something surgical if necessary. So.
Okay, very good. Good luck to you. Let's go to Darla. Darla, good evening to you. What's your question?
Evening. I'm somewhat accident prone, so I don't generally pay attention to little bumps and scrapes and things unless I absolutely have to. And what happened recently, I'll preface this by saying that two things: that I've already got an appointment with my primary care physician, and I will likely be referred, and I'm thinking maybe for x-rays, and that I have Googled some information about it, but I know about reputable medical sites and those that aren't, and that you can, there's a range of things that any one symptom could mean, so I've got all of that in mind, and I actually broke or sprained a finger at one point, so I kind of dismissed this because as I vaguely remember injuring my finger, but it's not really, I couldn't tell you exactly when or what, under what circumstances, but what forced me to pay attention is what formed. I thought it was just that I sprained this finger. It wasn't the same finger as before, but it either sprained it or broke it, and it just wasn't healing correctly because in my knuckle there's a big bump there. But I've since learned that it could be anything from this disease that starts with a D that you're probably familiar with to any number of things, and I'm definitely going to do something about it, but I just wanted to give me kind of an idea. In that instance, they said basically where it was this kind of like the worst case scenario is that you have pain when you bend your fingers and so forth. There is absolutely no pain.
Yeah, it's really difficult to know for sure, but I can tell you most of the time if there's a lump or bump on your finger, if it's around the joint, it can be several things that it could be. You're referring to a word, this D word. It's called a Dupuytren's contracture, which is a hand ailment where the finger develops these little lumps and bumps, and it also brings the finger down into a contracture. It really can cause a lot of problems. But you described that you're not having a lot of pain, and it's possible that this lump or bump could be what's called a ganglion cyst. That's a very common finding. What that is a little bit of joint fluid, which actually gets outside of the joint, forms a small bubble. They're benign. It's not like it's a cancer or anything like that, but they can take up some space, and they can be uncomfortable for many patients. But for many, it doesn't bother them in terms of pain, but they can see it, they notice it.
Is this something you drain if it is bothersome, or what happens?
Exactly. There's several ways that you can get rid of it. Sometimes they'll just go away on their own, so it's okay just to watch it. And then if it's bothersome for patients, we sometimes either drain it or we put a little bit of cortisone and numbing medicine in it, and then that sometimes will pop it, and that will sometimes get rid of it. Sometimes it doesn't go away, and patients want to get rid of it from a surgical standpoint. We just remove it that way.
Gotcha.
So it's a small outpatient procedure, but sometimes these lumps or bumps are common to see around the finger. It could be an arthritic nodule, and so sometimes a little bit of arthritis will form these nodules.
Okay.
Yeah.
All right, great questions already. If you have a question for Dr. Haslam, we're going to take a quick break. We'll go ahead and get you lined up, so be watching. We'll be right back.
Hi, I'm Kevin Kennedy with the Kennedy Law Firm. You know, a wise man once said, when you need to get something done, do it now. At the Kennedy Law Firm, we agree with that. If you're confronted with a divorce or a bankruptcy or a car wreck or a criminal charge, call us today.
If you spend any amount of time in the great outdoors, hunting or fishing, you need to watch Southern Woods and Waters on News Channel 5+. Join host Hugh McNaughton and our area's top sportsmen as they share their experience and knowledge. Southern Woods and Waters is all about Middle Tennessee, and it's live. Call in with your questions. Whatever the season, that's what they're talking about. Tune in to Southern Woods and Waters Thursday night at 8, or catch the encore presentation Sunday night at 8 on News Channel 5+.
If you want to shed the fat and sculpt your body to get that slim, sexy look of your dreams, then you need to stop working out.
Say what?
And start rocking out with Rockin' Body, the fun new body makeover system that was created by fitness expert and Insanity creator Shaun T.
Rockin' Body combines dance and fitness in a fun new way so you can achieve insane weight loss.
I lost 30 pounds dancing.
Now you can tone and tighten your abs, shrink and shape your hips and thighs, and lift and firm your booty, all while you're just dancing.
I've lost 33 pounds. I feel sexy.
And now, for a limited time, the complete $80 Rockin' Body system is 75% off. That's right, Rockin' Body is only $19.95. We'll even upgrade you to express shipping free. Get the complete Rockin' Body system for only $19.95.
Call 1-800-307-0417 or order online at rockinbody.com. 1-800-307-0417. Call now.
When faced with cancer, the search for resources, education, and hope are essential. The mission of Amgen's Breakaway from Cancer is to help those in need.
When I was diagnosed, I vowed not to give up on my dream of being a professional cyclist. The work that Breakaway from Cancer and the cancer support community are doing is a win for everyone affected by this disease.
At breakawayfromcancer.com, Breakaway from Cancer and its nonprofit partners offer services to complement those provided by your medical team.
When my brother was battling cancer, I needed help navigating the mazes of healthcare and insurance issues. Breakaway from Cancer and the Patient Advocate Foundation helped me find my way.
From emotional support to financial assistance and finding hope.
Through Breakaway from Cancer, I found a community that inspires me.
Whether you or someone close to you is newly diagnosed, finished treatment, or just wants to reduce risk, Breakaway from Cancer is here to help. Go to breakawayfromcancer.com to get started now.
Hi, I'm Kevin Kennedy with the Kennedy Law Firm. You know, I'm often asked, how do you get those big settlements? We won't stop till we get to the top on the negotiation. That's how you get the big settlements. I'm Kevin Kennedy with the Kennedy Law Firm. Call us today.
Welcome back to Medical Monday. I'm here with Dr. Jason Haslam. We're talking about all things covered by an orthopedic surgeon because that's what Dr. Haslam is, but especially the hand, wrist, and elbow and shoulder today. So if you have any questions, any pains and aches concerning that, go ahead and give us a call. The number is on the screen. 615-737-PLUS is the number to call. We're going to jump right to the lines. Helen has been patiently waiting. Helen, go ahead with your question.
Yes. Hi, my name is Helen Ambrose, and my left arm, I recently, well, not recently, but 15 years ago, I had a four-wheel accident, and I broke the right arm, or left arm, I'm sorry, above the elbow, and blew the elbow, and I had surgery with pins put in it to correct that problem, but I'm still not able to, like, bring a cup of coffee to my mouth or touch my face with that arm, and I was going to have elbow replacement on that arm, but it sort of scared me. I don't really know what I should do. And my question is, do you think that would be the best thing to do, or would there be another way to correct that problem?
Well, Helen, I think you're describing a problem with your lack of motion. When you can't bring your hand up to your face, that usually means the elbow's not able to function well enough to get up there. So, and that's very common after you have an injury, for example, a fracture around the area of the elbow. So, yeah, the decision to do something like a total elbow replacement, that's a big, big decision, so I can understand your apprehension. It's a big surgery, too. But the best thing to do is perhaps, well, you know, in my mind, I'm thinking, I wonder what that elbow actually looks like. So a good set of x-rays will give us a lot of good information about your elbow, and may give us some information on, or at least help us, guide us on how we could best treat you. The short answer to your question is, should you do a joint replacement or not? It really depends on what your x-rays show. And though it's a good operation, it is a big one. And so other types of options that might be available to you would be what we call a capsular release, and that's where we release the joint capsule or the ligaments to allow more motion of the elbow. And we oftentimes will do that using what's called an arthroscope. So we use a small camera to get into the elbow and look around. If there's other things, for example, if there's a bone spur which is blocking the motion of your elbow, sometimes we can actually remove that with using just the camera, and sometimes you can preserve the joint. My preference is to try to preserve the joint, but when it's not something that's salvageable, then we end up going with the total elbow.
If she had an x-ray and what would be the things you go, oh, this is not good? What would it show?
Well, the classic x-rays with bad findings would be elbow joints that no longer have cartilage in it. Or there's very large bone spurs around which are blocking the motion. Those are the ones that I get concerned about, because no matter what you do, if you don't have cartilage, it's just not going to work well. So that's when you resort to the total elbow arthroplasty, or the elbow replacement that you're talking about.
What kind of recovery time are you looking at with an elbow replacement?
So once you put them in, it takes around 6 weeks to kind of recover from the healing process. And during that 6 weeks, we start physical therapy. You're in a sling for a short period of time, but the design of these elbows is to get them moving quickly, because you know, one of the biggest problems is range of motion, so they're pretty aggressive about trying to get that motion back. So there are elbow replacements, just like there's replacements in the knee and hip, and elbow replacements have been out for a long time, but their ability to stand a long period of time, that's not that great. So they only last around 7 to 8 years on average, in general, depending on how you use them.
Wow,
so,
that's interesting.
Yeah, and then if they fail, or if they're not working very well, then you end up having to go back in and do a revision surgery, and the complication rates go up double.
Okay,
so it's a serious operation.
Good information. Hopefully that helps you out, Helen. Gwen on the line. Gwen, thank you for calling in tonight. What's your question?
Well, I have inherited some bone conditions like osteoporosis, but I was wondering if you can inherit carpal tunnel syndrome.
We actually don't know exactly why carpal tunnel syndrome happens, but the reality is it is DNA based, and many orthopedic surgeons and hand surgeons believe that carpal tunnel syndrome probably is related to genetics. And so the short answer is yes, you are probably right. You can inherit maybe the factors that affect carpal tunnel syndrome. It's probably a multifactorial problem. There's probably several things that cause it. We do know that endocrine changes, for example, if you have diabetes, that puts you at a higher risk for developing carpal tunnel syndrome. Even endocrine changes, even with pregnancy, it's a higher risk for women that are pregnant to have carpal tunnel syndrome. So there are some factors, but you're absolutely right. There are genetic factors involved too.
And I guess if you have it, it just stinks either way, whether you inherited it or it's because of overuse.
Yes,
it just
hurts.
stinks. Yes, it hurts. There's no change in it. Okay, Sandy is on the line. Sandy, go ahead with your question tonight.
Hi. I'm 67 years old. I have these cramps that come in my fingers, and it's like if you have a cramp and you have to stand on it with your foot to get it out of your leg. They're very painful. But if I take my other hand and work and move it around, it will release and go away. But it's no pattern that I can figure. I'll just start to pick something up, and I'll have like just a major seize cramp.
So kind of like a Charlie horse in your finger?
Kind of like a Charlie horse in my fingers.
Okay, well, let's see what Dr. Haslam has to say about that.
Just a quick question for Sandy.
Okay, hang on, let me see if I can get Sandy back on. Okay, go ahead.
Quick question for you, Sandy. Do you have symptoms at nighttime? Does it ever wake you up?
Yes, it has awoken me, yes.
So what you're describing is kind of this cramping in the hand. It's very common to see with this diagnosis of carpal tunnel syndrome. When you're using your hand, a lot of times you'll develop this cramping, and it can be just on one side. And that's a very common finding with carpal tunnel syndrome. Many patients that have carpal tunnel syndrome also have a lot of symptoms at nighttime, so that's oftentimes the first question I'll ask is, what's happening at night? Does it ever wake you up? Many patients will find they have to shake their hands.
Is it just from use during the day?
We don't know exactly why. We do know that it's a compression on that nerve, and for some reason, many patients at night, I don't know exactly why that happens, but that nerve will really start to become irritable. But it's frequent to have patients have cramping in their hand. Nowadays, it used to be holding a newspaper. Now it's I'm holding my cell phone or texting away, and I can't text. So it's very common to see that particular problem.
You start to pick up a cup of coffee or anything, and it'll just like lock.
Yeah, it's very common, and many patients will drop objects. So I suspect, just listening to what you're describing, it's highly likely that you might have carpal tunnel syndrome.
Okay.
Sorry to deliver the bad news.
Thank you so much.
Thank
You're
you,
welcome.
Sandy, for calling in. We appreciate it. Man, I tell you, these phone lines are just lit up. We're going to get to Lisa now. Lisa, thank you for calling in. Lisa, are you with us?
Yes, I am.
Good, go ahead.
Okay, I have a question. The doctor said I had carpal tunnel, but every night my hands swell up and I can't move them. And I try to get a brace, but my hand is so small that the brace doesn't fit. What do you suggest?
Okay.
Well, sometimes it's hard to find braces that fit you, and so it's worthwhile to try to get one. In our office, we have all different sizes. If your hand's small enough, we can even have pediatric braces, so we can always find a brace that's going to fit you. That's the mainstay of treatment. We try to get it better with the brace, but if that doesn't work, come into the office. Let's put a little cortisone or medicine around that nerve and see if we can't get it better for you. Carpal tunnel syndrome, it's related to a nerve, and so there are other tests that we can get to diagnose it. There's what are called electrodiagnostic studies, which basically test that nerve almost like you would test a wire to see if it's conducting electricity appropriately. And we'll oftentimes get that test if there's any questions about whether you have carpal tunnel syndrome or not.
Is it definitive?
It's not definitive. It's just a tool.
Good guide.
Yeah, it's a guide that helps us to understand how bad that carpal tunnel syndrome is. But it's not definitive. Unfortunately, there's not a lot of definitive tests in medicine.
True. Okay. Elma's on the line with us. Good evening, Elma.
Hi,
go ahead. Good. Go ahead with your question.
Okay, I wanted to ask the doctor. I had carpal tunnel surgery about 19 years in both wrists at the same time. How long does that last? I haven't had any problems, is what I'm saying. I just wonder how long that lasts.
Look at the literature on carpal tunnel syndrome. There is a recurrence rate after you do surgery. It's about 10% of patients will have a recurrence within about 10 years. So you've had 19 years on your carpal tunnel. That's pretty good. If you came into the office and I was suspicious that you had carpal tunnel syndrome, I might get that nerve test to kind of see how bad your nerve really is. But it's very possible that you could have a recurrence of carpal tunnel syndrome.
Okay. Thank you, Elma, for calling, and hopefully everything holds okay for you. Edna is on the phone with us as well. Miss Edna, go ahead.
Yes. I brought my husband cigarettes, and I've had a knot just come up on my arm, around my hand, my left hand, and it swells up. And now it's moved about 2 inches up, and it's swelling up. And I get knots on them, and I was
So those knots that come up, the most common knot that forms around the area of the wrist is what's called a ganglion cyst. We mentioned that just earlier. And again, what that is, and most likely what it is this ganglion cyst. It's fluid which comes outside of the joint and forms a small bubble. Sometimes it's a large bubble in your situation, but they can be quite large. Sometimes they don't hurt patients. Other times they're worried about because it's a cosmesis problem. It's so large. Sometimes it does cause a lot of pain. So ganglion cysts, they can be either drained, removed. You can just watch them. Sometimes they'll go away on their own. But that's probably what it is. To know definitively, we have to see you in the office and sometimes use an ultrasound.
Okay, very good. On that note, we're going to take a quick break. We do have a few phone lines open, so if you want to give us a call, now is your opportunity. 615-737-PLUS is the number to call to talk to Dr. Haslam, and we'll be right back.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
With this Storm 5 weather update, I'm News Channel 5 meteorologist Henry Rothenberg. Active on radar, that's going to continue as we go through your Monday evening and into the overnight. These spring storms and showers and no and thunderstorms. This is what it looks like at Nashville International Airport. This is updated every hour. Your forecast tonight, a mild one, down to 60 in the city. Maybe with some rain, some outlying areas fall to about 57 or 58, but we'll keep it at 60 in the metro area. Again, some scattered showers and thunderstorms. Tomorrow, really little change. Mild with more thunderstorm chances. We'll only put a 20% of rain in the forecast for Wednesday and Thursday. Temperatures in the 80s before another cold front moves in to end the week and brings more thunderstorms.
Every time I hear the alarm bell go off in school, I think it's an air raid.
A lot of houses in our neighborhood have been destroyed. I like to close my ears and sing songs whenever the bombs come close.
I'm worried our new neighbors won't like us.
But I know it's all gonna be worth it. I just want my family to be safe. But these are not my words.
These are not my words.
These are not my words.
If you've got a yard, you may plan on digging in it, like to build an addition, put in a pool, or bury your pirate booty. But you should know that throughout the country, there may be pipelines buried underground, and if you hit one, you've got trouble. Sorry. So before you dig, call 811 to have any buried pipelines located.
Utility or visit pipesafety.org. Brought to you by the Tennessee Gas Association.
Welcome back to Medical Monday. I'm Carrie Sharp here with Dr. Jason Haslam, and we are talking about all things related to the hand, the wrist, the elbow, the shoulder, and really you cover the entire body, but that's what you specialize in as an orthopedic surgeon. If you have any questions for Dr. Haslam tonight, go ahead and give us a call. We have a couple of phone lines open. 615-737-PLUS is the number to call. Chad and Laura, I know you're on the line. We're going to get right to you, but I love show and tell, and you brought a few joints and different contraptions here. Show me what you have.
Well, in orthopedics, when the joints become so damaged, we end up just getting rid of the native joint. We do joint replacements, and many patients know about hips and knee joint replacements. And in the upper extremity, we also have joint replacements, which are made out of metal and plastic. And I brought a couple here. This one on my right here is the wrist joint. That's an artificial wrist joint. There's many patients that suffer from arthritis or have had post-traumatic arthritis, injured the joint. And when it's not salvageable, sometimes we'll use a joint replacement versus, for example, a fusion, which you lose motion. This is designed to maintain motion. We put those in patients fairly frequently for those particular problems. We also have this really small joint. It almost looks like a little tiny knee joint, and it's designed very similar to a little tiny knee joint. And we actually use that for the knuckles. These what are called the proximal interphalangeal joints. We'll oftentimes use it for these knuckle joints. And when they become very arthritic and patients are having trouble with it, we'll sometimes use that. We use those to preserve motion. We used to use a lot of fusions, and now these have become much more mainstream. They're much better materials, and I think they're a lot better for the patient.
If you have arthritis, when do you know doing a joint replacement is the right step? Because so many people have, you see their crippled hands, and when do you know it's right?
So that decision ultimately is up to the patient. So when patients keep coming back and they're having a lot of difficulty with a particular joint, and we've exhausted the conservative treatments, for example, perhaps injections or even bracing or physical therapy, if that stuff isn't working, then patients will sometimes opt to go with these types of options, which are small joint replacements. So ultimately, the patient decides, and I think they work very well for certain situations. They're not perfect, but it's a good option for many patients.
Is the recovery from joint replacement surgery a lot different these days than maybe it was 10 or 15 years ago?
Yeah, I think so. I mean, the reality is these particular joint replacements, the materials themselves have improved. The way that they're fixing in the bone is also improving. So a lot of times we can get patients moving a little faster. The technique is also important depending on what structures you cut to get into those joints. A lot of times we're using tissue sparing techniques to try to get into the joint, preserve some of the main ligaments and the main tendons so that we can start early range of motion activities right after joint replacement. It can be very helpful for patients.
I would imagine. All right, let's jump back to the phone lines. Chad is on the line. Chad, thank you for calling in tonight. What's your question?
Hey, guys.
Hi.
I had a question about my fingers. I'm 26 and I wake up in the morning with my fingers extremely stiff sometimes. It's not really pain, it's just mobility issues. But as soon as I shower and the hot water hits my hands, it starts to feel better. From your show, it kind of sounds like I have carpal tunnel syndrome. This has been going on for like a month now, and I don't have health insurance. what do you think I should do? Any home remedies I can apply, or can I get a cortisone shot without a primary care physician?
Sure. Well, yeah, that's a good question. So it sounds like you're having some stiffness early in the morning time when you wake up, and that is a very common finding with carpal tunnel syndrome. So you're right. It's possible it could be something like that. But home remedies that might be helpful, we'd mentioned using a brace. Try wearing a brace at nighttime. You can even pick those up at the pharmacy, is what we talked about previously. And that might really help you. I would try that first. And anti-inflammatory may be helpful for you, Chad. And so taking, like, for example, Motrin or ibuprofen, it's an over-the-counter anti-inflammatory, can sometimes be helpful for you, for that stiffness that you might have in the morning time. So I'd certainly consider trying that. Sometimes it's none of those things, and we need to get an x-ray to kind of get a better understanding about what the joint looks like. There are other diseases. For example, rheumatoid arthritis can sometimes cause that type of a stiffness, but x-rays sometimes can be helpful in diagnosing that. So several things it could be, but those are some of the more common ones.
But maybe start with the ibuprofen and then the brace and see where it goes.
Yeah.
Okay, Chad, thank you for calling. Thank you for your patience tonight. Let's see, Laura has been hanging on. Laura, thank you for your call and question. What is it?
Hi, thanks. I actually have this pain at the bottom of my thumb, kind of close to my wrist. If I put pressure on it, doing anything, it's really extremely painful. When I'm doing things like push-ups or opening jars, things like that, it really hurts. And it seems to me like it swells up sometimes, and I'm not sure, what that could be.
Yeah. So, Laura, pain around the base of the thumb is a very common complaint with patients that come in with arthritis around that area. It could be something like that. It could also be other things close to that area, including where a tendon runs over the base of the thumb. It could be something similar to that. But arthritis of the thumb is very common. It's the most common arthritis condition around the hand and wrist, is right there at the base of the thumb.
Why is that? Why so common?
Well, this thumb of yours is, we're different than the you've heard that, where we're different from apes. It's because we have this opposable thumb.
Right.
And at the base of the thumb, it has what we call a saddle joint, which allows the thumb to cross over and oppose. It makes us completely different than other animals in the animal kingdom. And I'm not trying to get off on a large tangent here, but what happens is that predisposes that particular joint to arthritis. And so it's a very common location to develop arthritis around the area of the hand and wrist. Overuse can sometimes cause that to be worse. Push-ups is a common finding where they put a lot of pressure on that particular joint. And it's a joint that we address as we get older. That joint tends to wear out quickly. And so it's something that, x-rays can give us more information about. Just a good physical examination in the office can sometimes pinpoint exactly where that problem is. So it may be something, Laura, worthwhile to come in and see us and maybe let us take a look at it.
Okay, Laura. And by the way, we are going to give that number at the end of the show here, so keep that pen and paper handy. We will give it out. I do assure you of that. Let's head to Nancy. Nancy, what's your question tonight?
Okay, thank you for taking my call.
You're welcome.
I have bursitis in my shoulder, which is so painful. I also have a tear in a ligament in my shoulder, very painful. I guess my question is, will the tear in the ligament, will that heal itself with the Celebrex, or?
Yeah, it's a good question. So many patients have that same question of whether tears are going to get better. For example, a rotator cuff tear is going to get better in a shoulder. It sounds like you might have something similar to that particular problem. Those tears don't generally get better in terms of they reattach to the bone on their own.
It's not going to heal.
It generally doesn't heal right away, but many patients can become asymptomatic.
Oh.
And the reason why that is sometimes, given it time, we'll have other parts of, for example, the rotator cuff take over, and many times patients will start feeling better. So giving it time, some physical therapy may be helpful. Anti-inflammatories may be helpful for it. So even though you may have a tear in a ligament, it doesn't necessarily doom you to having to have surgery or doom you to have a life of pain. Many times these things can get better.
She mentioned bursitis too. What is that?
So your shoulder has this, it's just this remarkable range of motion where you can actually windmill your arm around. You see pitchers do that all the time. There's no other joints that have that capability. In order for a joint to do that, it has to have this interface between something that moves and doesn't move. there's an interface there which is called a bursa space, and allows that transition to happen between moving things and non-moving things. And when that interface, that little bit of tissue, becomes inflamed, we add a little itis on the end, and that's called a bursitis.
Gotcha.
That's where that term comes from. It's inflammation of that area of the shoulder. It's very common and can be extremely painful, so it's something that we see quite frequently.
And what do you tell your patients?
Well, similar to kind of what we talked about before, we try to avoid doing surgery on those. We try anti-inflammatory medications, physical therapy, heat and ice, give it some time. If it's not getting better with that, we'll oftentimes try to decrease the inflammation by using a cortisone injection. So those are very common to use. And last resort is sometimes we use surgery for that particular problem, but a lot of times we can get it better without having to do that.
That is good news. Let's hop to Renee. Renee's been patiently waiting. What's your question, Renee?
Well, thank you for answering my call.
You're welcome.
I had a problem. I have a problem with my left wrist. For no reason at all, it just started hurting yesterday, and it's extremely painful. I mean, whenever I try to move it to do anything, it hurts.
Well, something that comes on very acutely, I always get worried that it might be something like a tendonitis. Carpal tunnel syndrome is a little more insidious. It takes a little more time for that to happen, usually. But when someone comes to me and says, hey, this happened within 24 hours, I'm oftentimes thinking of, for example, a tendonitis around the wrist. So, but those are fairly easy to diagnose, and they're very pinpoint. So if you come into the office, we can sometimes pinpoint the location and find out exactly where the problem is very quickly. Sometimes it requires an x-ray, but a lot of times it's just a physical examination, finding out exactly where you're hurting.
The pain shoots all the way up my arm when it does that. And I mean, there is no swelling because I had the nurse at work look at it today.
Yes, yes.
She told me to just leave it alone for a couple of days, not to do anything with that hand, to see if it would fix itself, and if not, to go to the doctor.
Yeah, that's not bad advice. So resting the extremity will oftentimes make the inflammation go down, so that's very good advice. But when it starts to radiate, that usually is either the nerves which are irritated or even the tendons. Remember, these tendons are attached to muscles which go up into the arm, and so if there's an area where the tendon is irritated, very common to see it radiate proximal, kind of up to the arm.
What do you do for tendonitis?
Well, a lot of times we'll use the anti-inflammatories, as the nurse had mentioned before, just resting it can sometimes make it feel a lot better. Sometimes we'll use a brace to try to force the resting, and sometimes that'll make it feel a lot better. If worse comes to worse, we'll apply a much more aggressive anti-inflammatory, for example, a cortisone shot.
Right.
And physical therapy can sometimes be helpful in the right setting for this particular problem.
When people say, oh, I've got tennis elbow or golfer's elbow or whatever, is that tendonitis?
We don't really call those particular diseases tendonitis. A tendonitis refers to the fact that the tendon is actually inflamed. It's more of what there's a term called tendinosis, and that's a fancy term the pathologists have made for us. That it's really a degeneration of that particular tendon. It's an aging of the tendon, but it can be very, very painful. It is something that we do treat frequently. Sometimes we'll use injections around the elbow for that particular problem.
Okay, interesting. Yeah. Miguel is on the line. Miguel, go ahead with your question tonight.
Thank you for your time, doctor. My question pertains to, I do a lot of overhead lifting of weights and whatnot, and sometimes I get this popping, almost painful. It seems to be getting worse, mostly with overhead motions, and sometimes raising weights in front of me.
Yeah. So that sounds like it's around the shoulder then, is that correct?
Yeah, more towards the top of it, I would say.
Yeah. So there's a lot of things that can cause popping around the shoulder. Again, the shoulder is one of those amazing joints that has so much motion, and so then you have this structure that's moving a lot around structures that don't move. There is that interface that we talked about, what's called the bursal space, and sometimes you can get some thickening of that, and that's probably where a lot of that popping comes from. If it's not painful, I usually leave that popping alone. If it becomes an issue where it's painful, it usually means it's becoming inflamed. And in those situations, that's when we start treating it. And again, very common treatments are anti-inflammatories. Sometimes we do injections which are very powerful to decrease the inflammation around the shoulder. They're very targeted injections. We use ultrasound sometimes to get to the spot that we need to get to. But it's very possible you could have a bursitis. It could be an acute tendonitis, which we had mentioned previously. Probably not a tear. If you're lifting weights, usually patients that have tears, they start to lose some strength in their arms. So it's probably related to some inflammation around that shoulder.
All right, Miguel, good luck. It brings me to a question of my own. You mentioned anti-inflammatory a lot, and obviously that's a great place to start. How long do you stay on those before you say, okay, this is not a lifelong remedy, I need to go to the next step?
Yeah, that's a good point. Those anti-inflammatories are not benign either, so they can have side effects associated with them, for example, ulcers and that sort of thing. So typically I'll have my patients take anti-inflammatories for a short period of time, and if they're not getting better, then we start looking at alternative treatments. Many patients can take those anti-inflammatories for years and not have problems. Sometimes we'll transition over to just a straight Tylenol. Sometimes that has a little less side effects that are harmful for patients. So there are some other options besides the anti-inflammatories.
Okay, good deal. We're going to take a quick break. We do have a couple of phone lines open, so go ahead and give us a call with your question tonight. 615-737+ is the number to call. We're coming right back.
The insurance company won't call me back.
We'll make them fix your car. You deserve to be paid for what you've been through, and you deserve to get your car fixed.
Thank you for coming out to see me.
You're welcome. We're just a phone call away.
Hola amigos, soy Marcela Gómez y quiero invitarlos a que vean nuestro programa Panorama, completamente en español, traído a ustedes por la Cámara de Comercio Latinoamericana de Tennessee y patrocinado por Nissan. Les traeremos información sobre la ciudad de Nashville, entrevistas con empresarios locales y un segmento de salud patrocinado por los hospitales HCA TriStar. Sintonicen los lunes a las 9:30 de la mañana en News Channel 5 Plus.
This week on Fishin' Affliction TV.
Oh my goodness, what a fish. That's a killer fish right there.
Join Team Fishin' Affliction as they're on American Sport Fish's secret lake trying to catch a tiger by the tail.
That's a tiger bass right there, and a good one. Man, a good one.
Your Fishin' Affliction TV weekend begins Saturdays right here on News Channel 5 Plus, your home for
Fishin' Affliction time for those who've got it bad.
She stands in the face of evil and will not lose hope or faith. America, the land of freedom, is still the home of the brave. So raise the banner.
Sky 5 rises and shines just like you do to get to the news you need faster than anyone else. The only full-time morning news helicopter. Sky 5 is a difference you can see every morning. Only on News Channel 5.
Welcome back to Medical Monday. We are talking with orthopedic surgeon Dr. Jason Haslam, talking about everything that mainly affects from the fingertips to the shoulder, although you cover all the body. One thing that piqued my interest, these wrist replacements. I've really never heard of that. Something you see, though, quite often.
Yeah, these are fairly new on the market, these wrist replacements, and they're becoming much more popular because they're, in all honesty, they're getting better and better. And we do use these fairly frequently for patients that have had, for example, post-traumatic arthritis. For example, the wrist joint is the most common joint that's fractured when patients fall down. And those fractures can lead to joints that become arthritic, and they wear out and become very painful. And in those situations, this may be a very good alternative as a joint replacement. So we use them fairly frequently. And many patients are very happy with them because you can preserve some motion, and they get pretty good pain relief with it.
Well, once you do the replacement, is the relief pretty, I mean, is it immediate once they wake up from surgery? Can they tell the difference?
Yeah, absolutely. Most patients can tell the difference. Of course, you have that post-surgical pain, which can be quite painful.
Sure.
So, but once that starts to wear off and they start to move their wrist, they start to notice improvement, and a lot of them are very happy with it. Yeah, absolutely. It's a great alternative. We used to do a lot of fusions for this particular problem, but now as these devices become better, we're starting to use them more frequently.
Well, I imagine if you're fusing the wrist, you would lose a lot of mobility, right?
Absolutely, and that's the biggest complaint about wrist fusions is the lack of mobility.
Yeah.
So it is a nice alternative for that. Yeah.
Okay. I do want to mention we have a couple of lines open, so if you want to give Dr. Haslam a call, now is the time to do it because we are running short on time for that hour. We have about 15 minutes left. 615-737-PLUS, and we have Donald on the line. Donald, thanks for being with us tonight. What's your question?
I have muscle problems in my back, my arm. I actually have knots similar to the Charlie horses we used to get when we were young. I'm over 60, still very active. I play basketball with young men, load stuff, but I have a real hard time sleeping the day or so after it hurts so bad.
And where exactly are these knots at? Are they in your arm, or are they around your neck, or where exactly did you say those were at?
I have one in my right arm. I have one underneath my left shoulder blade.
So what's interesting that you talked about, you mentioned, you started off with your neck and your back area. So the neck supplies all these nerves that go down to the arm, and it's always in the back of my mind. I'm always worried that it might be an impingement on the nerves around the neck that may be causing upper extremity problems. So it's very possible that might be what the cause of these Charlie horses. If those nerves are irritated as they come out of your cervical spine or your neck area, it'll irritate the muscles, and then a lot of times patients will get those Charlie horses or those knots. It's very possible that could be where it's coming from. Good physical examination might be able to tease that out. I'd certainly encourage you to come to the office and let us take a look at you.
All right, Donald, good luck with that. And of course, we're going to give you that number, so get a pen and paper ready. When I was reading through some of your notes that were prepped for this show, Dr. Haslam, one of the syndromes that you listed that you deal with, it has to deal with cold hands. And I've always heard the saying, oh, you have cold hands, you must have a warm heart. There's actually a syndrome that deals with cold hands. Tell me about this.
So it's kind of interesting. There's a group of patients that have a syndrome called Raynaud's syndrome. And many patients that have this particular problem, if they get in very cold environments, it actually can clamp down the vessels that go to the tips of the fingers and cause damage to the tissues.
Yeah.
And for many patients, it can cause ulcerations around the tips of the fingers. There are treatments for it. Most of them are medically based. There are some surgical treatments that can sometimes help that. But if you're apt to get ulcerations, they can be very painful at the tip of your fingers also. But it's called Raynaud's syndrome or Raynaud's
Is it very
disease.
common, or is it very...
It's not very common to see, but it can be quite debilitating for many patients that have it.
I just didn't know that was even a thing. That's very interesting.
Yeah,
okay.
we see that frequently.
Learn something every day. Travis is waiting ever so patiently on the line. Good evening, Travis.
Hello.
Hi.
I was out doing the Easter egg thing, and I tripped and fell, and ever since then my shoulder's been hurting. I normally sleep on my side, and it's affecting my sleep. My doctor said I probably need to come see an orthopedist and try to find out what was going on with it. He said something about maybe a rotator cuff or something like that, maybe a partial versus some kind of full tear or something.
So what you're describing is one of the more common complaints around the shoulder, is where patients have had a fall and they have a lot of pain after that fall, and it just persists. It becomes a problem at night. You can't sleep. You roll over on it, it wakes you up immediately. It can be absolutely debilitating in terms of what you need to do the next day and work activities. So very common scenario that you've described. So what most likely has happened is you've taken your shoulder's a ball and socket joint. You've taken that ball and socket joint and you've forcefully moved it either up or around that socket. And there are structures that sit just above it, which are bone. And there's a little interface between that bone and your rotator cuff. And most likely you've probably injured the rotator cuff tendon or that bursa space that we've talked about and caused this inflammatory response. Many times you haven't done tears or major damage, you've just caused an inflammatory response. Many times these things will get better with some time, anti-inflammatories. But like you, the suggestion is maybe come see an orthopedic surgeon, and that's what we do. We see this all the time, and a lot of times if it's not getting better with our anti-inflammatories in time, then we'll start treating it with maybe perhaps an injection with some cortisone around it. That sometimes helps. If it doesn't get better with that, then we have other more aggressive treatments, including physical therapy. And sometimes we have to get advanced imaging studies, for example, an MRI, and that'll give us a lot more information about what might have happened to your shoulder. But hopefully it can get better for you. Again, it happened fairly recently, so there's a good chance it might just go away. But if it doesn't get better, we're certainly available for you, or any orthopedic surgeon will feel very comfortable taking care of that for you. Okay, thank you, Travis. Good luck there. Robert is also on the line. Good evening, Robert.
Good evening, and hello to you, Doc.
Hi.
I'll try to make this quick. In 1990, I was in a head-on car collision, and my right collarbone was crushed, and the ball joint, area was damaged. Well, it took me 14 years and not being able to get out of bed anymore because of the pain for me to go and get it surgically repaired.
Yes.
And at the time, the orthopedic, a great surgeon up in Chicago, he said that this was a one-time event healing the damage in the scar tissue that formed, by waiting so long. Well, 4 months ago, I had an unusual fall where my orthopedic says I may have suffered an impingement in the ball joint area.
Yes.
I've gone through 2 cortisone shots, and I don't know really where to head from here. Should I just ask for an MRI and then hope that whatever damage, because the pain is still unbearable. I'm, like reaching behind with my right arm behind my head. The pain is unbearable, and same with just moving my arm, like in the sitting position to the right. I can feel everything in that ball joint area. Don't do it. I can tell you're doing it right now. Yeah, what you're describing an old trauma to the shoulder area. So in my mind, the red flags of perhaps that joint has some problems with it. For example, you may be developing arthritis in that shoulder. Certainly, to request an MRI is certainly reasonable. I'd probably start off with just a good old-fashioned X-ray around the shoulder just to make sure that that ball and socket joint is actually okay from an imaging standpoint. A good physical examination can sometimes tease out the diagnosis. You had mentioned impingement syndrome. It's very common. That's where the ball impinges on the bone just above it, and it can cause irritation. But because you have that history of old trauma in the past, I'd certainly want to get an X-ray to make sure that there was no post-traumatic arthritis. It sounds like you have a lot of stiffness in your shoulder joint, and it may be related to that. Yeah, sounds like he needs to get in somewhere and not live in that pain. Yeah, especially if it's lingering like that. Come in and see us. We'd be happy to take a look at it. Okay, on that note, I want you during this commercial break to go grab your pen, grab your paper. When we come back, the numbers, the website, the email, everything you need to get in hold of Dr. Haslam. Stay with us.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
With this Storm 5 weather update, I'm News Channel 5 meteorologist Henry Rothenberg. Active on radar, that's going to continue as we go through your Monday evening and into the overnight. These spring storms and showers in no hurry to push out. Mild temperatures locked in as well. That's keeping it at least comfortable out there, but it's also noticeably humid as we have all this moisture in place for these showers and thunderstorms. This is what it looks like at Nashville International Airport. This is updated every hour. Your forecast tonight, a mild one, down to 60 in the city. Maybe with some rain, some outlying areas fall to about 57 or 58, but we'll keep it at 60 in the metro area. Again, some scattered showers and thunderstorms. Tomorrow, really little change. Mild with more thunderstorm chances. We'll only put a 20% of rain in the forecast for Wednesday and Thursday. Temperatures in the 80s before another cold front moves in to end the week and brings more thunderstorms.
So there you are. It's flu season, and you're over 65 like me. You're having another busy year. So much to do. So many roles in life to play.
Left off.
But you feel like you might be forgetting something serious. Your annual flu shot. And before you know it, it's too late. It's not just the aches, fever, and chills that last for days and days. The flu can be life-threatening, especially if you have chronic conditions like diabetes and heart disease, which can worsen with the flu.
Being active and healthy alone won't protect you. The immune system weakens with age, making you more susceptible to the flu. If you're over 65, ask about your flu vaccine options, including one made specifically for us. An annual flu shot is the best way to help keep the flu away.
Visit the National Council on Aging at ncoa.org/flu to learn more and talk to your healthcare provider about vaccine options for people 65 and older.
Thank you for being with us tonight for Medical Monday. I hope you've learned a lot, and certainly we've gotten a lot of questions answered tonight, which is always great. Thank you for being with us, Dr. Haslam.
You're welcome.
You are spread out. You divide your time through a couple of different offices. Tell us again where you are.
So my main office is in Nashville, but I have satellite offices in Dixon and in Clarksville. There's the Dixon office is called Dixon Orthopedics and Sports Medicine. The Clarksville office is called Performance Orthopedics.
Okay, easy enough. And here's a great way to get a hold of Dr. Haslam if you would like to go in and see him. We're going to put those numbers on the screen. There it is, 615-986-6033. Or just send an email or head online to advancedhealthmedicalmondays.com and we'll get you started there. Thanks for being with us. Have a great night.